Hi, I'm Dr. Rob, and I wanted to welcome you here today to the next Dr. Rob's whiteboard session. Now, today's whiteboard session is going to be different than those in the past in that today I'm going to be sharing with you my own personal before and after picture. That's right. In just a few seconds here, I'm going to share with you, really for the first time ever that I've done this in a public setting, my own personal transformation photo. And you're going to see that in 3, 2, 1, bam. There it is. Now, I'm not very proud of the before picture, but I sure am of the after picture. And when I do share this with someone in a one-on-one type of setting, I think the question that pops into their mind is, how did this happen? And that, to be honest, that's the same kind of question that popped into my mind. I think what happened is, I've been in practice for 18 years and I've run a successful practice. And there was a point in time during my own career where I really focused just 100% on my patients and my family and some other things, and really didn't give much attention to myself and my own health. And I think I thought, like, as a doctor that had all this knowledge, somehow the knowledge protected me and made me invulnerable to disease. And boy, was I wrong. Because I developed some pretty serious problems with my liver. As you can see, I gained a lot of weight. And the problems or the symptoms I had, the exhaustion was so bad that I was out of practice for about 3 months. In fact, I was so sick, I actually thought at one point in time, that was it for me. I thought God was calling me home and the story was going to be over. And with God's help, and I think just smacking myself in the head and saying to myself, I've helped so many patients get well and lose weight and overcome their diseases. I can do the same for myself. And that's exactly what I did. I took the same technology that we have available in my clinic, and I applied that technology, those concepts, those ideas to myself and my own health issues. And as you could see, my health significantly improved. So, okay, enough about me and my own issues. I want to share with you a couple other patient photos, okay? So let's take a look at this patient. She lost 84 pounds, off her arthritis medication, off her reflux medication. This patient lost 93 pounds, insomnia gone, energy has been restored. This patient lost 42 pounds. She's off her anxiety medication, depression medication, off of her cholesterol medication, and, which is pretty cool, she's back in, she said she feels like she's in high school because she's actually wearing the same blue jeans that she wore when she first met her husband, which I think was back in high school. So the bottom line is, each one of these patients, and myself even, had one thing in common, and that is we all understood what was wrong with our body and what we needed to do to get healthy. Because you have to be able to identify what your body type is and what you need to do to get healthy. So for example, maybe your body looks like this one right here, and maybe you have trouble with fatigue, and you wake up at 2 or 3 o'clock in the morning and have trouble falling back to sleep. And maybe you crave carbs and have that fat right around your midsection. Or maybe your body looks like this, right here, and you have weight all over your body, especially under your arms. You have a lot of extra material that just wiggles and jiggles. And maybe you crave carbohydrates and are fatigued no matter how much sleep you get. Or maybe your body looks like this one over here, and your weight is mostly in the lower half of your body, buttocks and thighs, and you crave chocolate. And your problems are more cyclical in nature and follow your menstrual cycle. The bottom line is there's different body types, and you have to be able to identify which body type you are, because each person's, or I should say each body type, has its own unique set of symptoms. Again, here's one more look at my before and after picture. If I did it, you could do it.